It's great honor to welcome and introduce our first eminent academic speaker, Honorable Dr. Srikanth Narayanam. He is BMS, University of Health Sciences, Andhra Pradesh, gold medalist in ophthalmology, MD from Bangalore University, PhD, Tilak Maharashtra Vidyapit Pune, postdoctoral fellow, Immunology and Molecular Biology, Center of International Research in Immunology and Disease, School of Medicine, University of California, Los Angeles, UCLA, USA, Fellow AIRTP, Advanced International Research and Training Program, University of California, Los Angeles, USA. He is presently working as Deputy Director General and Director General Additional Charge at Central Council for Research in Ayurvedic Sciences, CCRS, Ministry of Ayush, Government of India, New Delhi, India. He is engaged in formulating, coordinating, implementing and monitoring various research programs, including clinical research, drug development, literary research, pharmacology research, phytochemical research, medicinal plant research, research-oriented public healthcare programs such as THCRP, NPCDCS program, etc. He has 23 years of research and teaching experience, holding the positions as senior lecturer and in charge principal at Indian Institute of Ayurvedic Medicine and Research IIMR and Sri Krishna Rajendra Ayurvedic Hospital, Bangalore, and assistant professor at Sri Kala Bhairaveshwara Ayurvedic Medical College and has 32 research papers in reputed international and national scientific journals, conference, proceedings, etc., and authored and edited 119 books, monographs and technical reports, and also contributed for development of about 14 policy documents and guidelines, including the National Ethical Guidelines for Biomedical Research in Human Participants published by ICMR, and possesses 3 patents to his credit. He has honored with 8 awards, including dedicated work in the field of Ayurveda by Kesari Maharashtra Trust and Nime Award for Excellence in Ayurvedic Shalakya Practices by Association Ayurvedic Profession of North America, etc. It's great honor to have you, sir, and we are very keen to listen from you about your expertise and your profound research work. Over to you, sir.
I'm expanding it. Thank you very much for inviting me for this presentation and introducing me. Good morning, good afternoon, and good evening, everybody. Today, I will put very brief about the sleep and sleep disorders, what is an Ayurvedic perspective, and what is the contemporary understanding. Before that, I will put a glimpse of what is the traditional medicine across the globe, and also what is the status of Ayurveda, very briefly, and I will proceed for what is the need of the contemporary period, particularly sleep and sleep disorders. We know that the traditional medicine it takes various forms in different countries. It is defined as the sum of the total of knowledge and practices used in particularly diagnosing, preventing, and eliminating physical, mental, and social diseases. We know this, and it is actually passes through the oral and oral traditions from time to time. This is very important for us. Actually, oral traditions are taking from one mouth to mouth, and also it is documented. Ayurveda is one of such ancient system of medicine which takes more than 5,000 years actually, and it is well documented and well studied also. And if you see the global status of the traditional medicine, if you see the global report of the traditional medicine 2019, which actually it also states that more number of countries actually are recognizing the traditional and complementary medicines because of newer health challenges which we are facing in the 21st century. It always recommends actually as integrating and converge the traditional medicine with the conventional medicine for particularly to meet the newer health challenges and many unmet needs also. If you see the status, out of 179 countries which are actually member states of World Health Organization, UN, that 98 had developed their national health policies, 1/9 has the actually launched their laws and regulation in one or other form. 124 has implemented regulations on herbal medicines and different traditional systems. If we see by 2018, we have seen the statistics, more than 85% of the member state had their own policies and all. Yet we have already known that WHO is also converging actually the recommends to converge the potentials of traditional medicines with the conventional medicine wherever we have requirements and best practices. We have to capitalize particularly to develop an integrative protocols where we have a good evidence and evidence for quality, safety, rational use and all. If you see Ayurveda, we know that Ayurveda is it is an ancient system which is codified 1500 BC. It is very oldest, one of the oldest form of the systems medicine in this world, which actually tells us the environment and body and everything is together. Actually, it is oldest system which is maintaining which tells us actually body as an integrated whole. Actually, it is was body, mind, senses, spirit, and also connects to its relation to the environment, which calls a loka purusha samyata, which is very very important in the context of sleep also. If you see the physiology of sleep also, the receptors and all, it relates to the environment and the signals from the outside also come and this is very very important for us, very very for us. Actually, it recognizes the concept of health as a state of harmony between physical, sensory, mental, social, and spiritual spheres. It's very very clearly known in this. In that, what we will come to the context actually sleep, which is also very very important to maintain the homeostasis of the body, mind, and senses, which is an indicative of the healthy status of an individual. Sleep is also a paramount actually. The proper sleep and good feeling of after awakening and unimpaired state of the mind and intellect of senses, these three are very very important, which are closely related to the sleep. What Ayurveda says about sleep is they're the three important pillars of the health. What Ayurveda says that one is food, ahara, which is very very important, and brahmacharya, that is one, and celibacy and a conduct of code of life, that is very very important, and nidra, that is the sleep, which these are the three vital components of the health, which actually maintains the physical, cognitive, and emotional balances of the health. That's why we know that it's very very well defined, it is well classified also. The physiology of sleep, if you see that what Ayurveda says, how a sleep is induced naturally. Natural sleep is when the sensory and motor faculties are fatigued. The what happens, the mind get detached from the different faculties and the other actions which are engaging. It slowly it ceases, then sleep is get induced. That's what Ayurveda says is yada tu manasik klante karmatmana klamanvita vishayobhyo nivartante tada swapatimanaha. How it is the physiology of sleep very very clearly defined. But what actually, why it is very very important, what are the different biological factors which are responsible, biological and other psychological faculties which are responsible for the sleep, how it is maintaining, what is its role in the maintenance of the health is actually the what Ayurveda says is everything, the nourishment, nidrayattam sukham dukkam, పుష్టికార్ష బలాబలం వృషదా క్లీబత జ్ఞానం అజ్ఞానం జీవితన్నచ. Everything is many important factors which are responsible for the health, which is a physical and psychological, are actually they depend upon the appropriate sleep. That is why proper sleep, which is actually responsible for the nourishment, immunity, strength, virility, knowledge, and maintenance of the life also. Improper sleep, the opposite, that causes the sterility, ignorance, misery, and even causes the death. If you see that these are the different factors actually. What important factor Ayurveda says is kapha. They are the three important biological factors in the body which maintain homeostasis of the, which is maintains, we call it as a health. that is out of that kapha, which is which is a humor, and another one is tamas, which is another the factor which is at mental level. These two are very important to regulate the quality of the and quantity of the sleep. Actually, these are the two things actually. When vata is increases, the sleep reduces. Pitta also increases, vitiates. It decreases the time of the sleep and quality of the sleep. And kapha is responsible for the appropriate sleep. But if kapha increases also, there will be abnormal sleep will be there. That Ayurveda classifies mainly sleep into the six varieties, which is from the physiological sleeps to the different other conditions, which is abnormalities of the disease and other things. One is actually tamobhava, when the mental faculty has predominance of the tamas, which is responsible for the, which is mainly causes the, which is sleep and all. It is also responsible for the sleep. Sleshma sambhava, actually the kapha, when different diseases, kapha dosha, which is increases also, or vitiates also, that also causes the sleep. And the exhaustion, physical and mental exhaustion also causes, that is manas serida sambhava, srama sambhava, that is due to the tiredness of the body and mind. And the advantages, external several environmental factors, and roga samudbhava, that is due to the sequelae of different diseases also, and the different complications of the different procedures also, we get sleep. And ratri sambhava, that is swabhavaja. This is called actually natural sleep, what physiologically induces. That's why these are the different classifications of the sleep. And the what is the importance of the sleep actually? Sleep in the daytime, other than the summer season, is not advisable, because kapha increases generally in the days, increases the it actually it causes different diseases like premeha and other staulia. Different diseases are attributed, etiologies of the different diseases are like obesity and all attributed, mesoroga, lipid disorders are attributed to the day sleep, because it increases the kapha. But summer, it is actually permitted. Actually, the day sleep is the outcome of, I told that mainly it is a different dosas, biological derangement of the different maladapted lifestyle, that also causes sometimes day sleep, because of the different in working environments and other things. And it is strictly contraindicated for the patients, particularly in obesity, staulia, lipid disorders, and other in dushi visha also. When a person is a poison unconscious at status going, and if he's that time, we have to monitor their things. That's why it is also, sleep is strictly contraindicated. The day sleep also causes different diseases, like general sleeplessness also causes most of these problems. Actually, it causes gaurava, that is heaviness in the body, anorexia, cognitive impairments, drowsiness, impairment of sensory and motor functions. These are the several things we generally observe also. And in the conventional medicine, if you see the sleep, actually, it is very conventional medicine also. Actually, understands the importance of the sleep, and it also advocated various times for sleeping. That's when from the newborn 14 to 17 hours to 7 to 8 hours in the older people. That's why there is a range which is given by National Sleep Foundation, sleep time duration, which you can download also. And it has been recommended different times, particularly for the sleep and all. Then this we have already seen that circadian rhythms which regulate the sleep. That's why we have already seen that the relation between the body, mind, environment also, which Ayurveda recognizes that that's why these signals ultimately causes and responsible for the sleep. But what is the Ayurveda's understanding of the insomnia, sleeplessness, and sleep disorders? There are two important classifications we can see. One is Swatantra, that is the primary insomnia. Generally, we see the causes is very difficult to understand and all. Then Paratantra, it is due to the secondary causes as a symptom to the complication of some diseases or sequelae of some diseases. Some symptom of some diseases itself causes the insomnia. What is the this etiological factors? It ranges from the lifestyle diet, and which causes increases the vata dosha and pitta dosha, and decrease the kapha dosha. Kapha kshaya also causes the nidra, and these are the different symptoms which causes the particularly how we can identify is, we know, we generally every day we feel that nidranasam angabhanga sirod gaurava drumbika Jajja glani prabha apakti tandra rogasya vataja. This is due to this chronic illness, the sleep it actually continues that and acute and chronic insomnias actually. We can see several of these symptoms, that is the exhaustion, feeling of fatigue and drowsiness, neuromuscular and complications, cognitive impairments, and indigestion generally we feel due to the sleeplessness. This is very commonly we can see, but it takes different forms actually, right from complete sleeplessness and other sleep disorders also. We can say hypersomnia, we have obstructive sleep apnea, we have delayed sleep awake phase disorders, and advanced sleep wake phase disorders. These are the different disorders we have, a set of disorders we can see. And these sleep disorders take more than 1.6% to 56%, the global statistics say. And among that, if the NIH surveys and NIH report says that in USA itself, 14.71% of population are suffering with this sleeplessness, where India is also, because of globalization and different change in the work culture, it is prevalence is now increasing. Among various diseases, we can see insomnia is also very important, and it is also having a different type of presentation. How we can recognize which is a, this is actually a contemporary understanding of nidra nasa, or it is a continuous problem, particularly in initiating the sleep, staying asleep, and also waking up early. These in the morning. These three are important set of the things which we can see continuously persist for 3 nights in a week, at least 1 month. We can understand this is the it is in a clinical condition of the insomnia. Previously, we have seen that various sleep disorders, really, sleep disorders and their incidence. Now we can see the insomnia is one of the most important among them, which causes really physical and mental and social trauma, particularly this, and due to the different reasons, and decreasing the work efficiency and all. And this takes 10 to 30%, sometimes 50 to 60% population we can see. And we can see in two important forms. One is acute and chronic forms. Acute insomnia, we can see it is last up to the 3 weeks, and chronic more than 3 weeks generally. And we can see 1 in 10 per 10th person actually. We can see this particularly this sleeplessness or kind of acute or chronic insomnia. Yet we have seen in Ayurveda also very clearly indicated that sleep disturbance or nidranasa has different consequences like and generalized body pains, malaria, and hypertension, obesity. It increases the risk of different obesity and different other disorders, and particularly children also. And it is in the school going children, we have to, there the daytime behavioral impairment, we can see different psychiatric disorders, anxiety, depression, and all. We can see that these particularly sleep disorders, particularly in the COVID-19 also situation. This is one unprecedented actually period. Actually, in last 2 3 years, we don't know what consequences happen after COVID-19, and post-COVID syndrome takes different forms. One among that, particularly this insomnia, sleep problems, actually 17 to 57% we can see, and which is causing a great physical and psychological trauma, particularly. And how we can manage this? This is very important, sir. But we with Ayurveda has a very good comprehensive management, particularly in different stages of the insomnia or sleep disorders. Particularly, sometimes we can make simple dietary management in acute and simple insomnias. In chronic, we can do the psychological oral medications and particularly panchakarma therapies. Particularly the food actually dietary items which increases the kapha dosha and which pacifies the vata dosha and pitta. That is very very important actually to manage the insomnia and other sleep disorders, particularly use of curds, yogurts, and freshly collected milk, particularly buffalo's milk and ghee, which is now known as a clarified butter, which is very very important to induce the sleep because it has a very good effect actually. Grutam pittani laharam rasasakra vojasam hitam. Actually, ghee is very very one is the important thing which we can manage the pitta and vata both. That's why we can. It is very important. Different grutas, medicated ghees also available. Brahmi gruta we have and other grutas we have, and that they are very very useful, particularly in managing this insomnia and sleep disorders. Psychological management, generally this is a generally it is very very important to counsel them actually to avoid fear and to have a good aromatic environment and it is very very important the environment to get a good sleep. That is also to keep everything conducive and pleasant atmosphere is also very very important. This is known to all of us and all. The pharmacological management very very important for all of us, and this particularly in several clinical trials also. I will put the glimpses of small some clinical trials conducted which is published in reputed journals. I will put one or two glimpses to understand how this works. Actually, ashwagandha Tagara, that is Velerina Valice, that's very, very important. Jyotishmati, Nardostokit Jatamamsi, Brahmi, Bacopa Maneri, Mandukuparni, Centella Asiatica, and Senkapushpi, Convolvulus pluricalis. These are the important herbs. There are several herbs actually, which used in the neuro pharmacological management of cognitive and sleep disorder. There are several medicinal plants, more than 30 are there, and these are the very very important well studied plants. And there are some therapies like panchakarma which contains abhyanga and akshitarpana tarpana, which is actually we can give in tarpana is actually will retain the oil and ghee medicated preparations around the on the eye. That is also very very important. And nasya karma nasal translational medications, nasya karma is also very very important. Hand massages, Padabhyanga foot massage, and these are very very important. In simple sleep, simple bathing also very very important, particularly in inducing the good sleep. And the external therapies, they are the four important therapies which we apply over head. That is called Murdha Taila. It is Abhyanga, Parisheka, Pichu, and Vasti. These are the four important forms of the external therapies which we will apply on the head. But it's a simple massage on the head, simple putting the cotton, which is our cloth, which is soaked in the medicated oils, we will put on the head, and Siro dhara, we can put continuous pouring of the streams of medicated herbal decoctions, medicated milk oil, and all we put for some time. That is Siro dhara. Siro basti, we retain medicated oil preparations on the head actually. That is also, these are the four important therapies which we generally give, and it is very very effective also, particularly Siro Bhenga, Siro dhara are very important. And these have very good effect, particularly not only in managing sleep and associated conditions of the sleep like fatigue and other, improving the body strength and also reducing the tiredness, physical and mental endurance it is improving and all. These are not only managed, it is a whole system approach actually, but particularly for this only very one or two important studies I can show you how these are helpful. This is one study which is ashwagandha, which is particularly in insomnia. In 60 patients, this is a double-blind randomized control study, and ashwagandha is given for 70 days, that is 10 weeks with milk. Particularly, several studies conducted. This is one example, and it has very significantly improved, particularly and Pittsburgh Sleep Quality Index piece. That is very, and anxiety scale. Actually, if you see this anxiety and others, and sleep actigraphy and all these are the very good markers or indicators how we ashwagandha has improved the sleep, particularly after 10 weeks. There is a good improvement in these indices and scores, and it's also improved the quality of sleep. Another is simple yoga with Sirodhara. Sirodhara we have seen is one of the therapies we have seen, the external therapies we are giving. This is integrative management of yoga, particularly pranayama, selected asanas and relaxation techniques with dhara, particularly for a week period given. And this has also given very excellent outcomes of improving the quality of the sleep and associated symptoms, and particularly in reducing the anxiety, and very good outcomes of these sleep indices actually. And another is simple tilataila, sesame oil, that is also Sirodhara. We are pouring the oil on the head, Dhara Chikitsa. This is around 20 patients. This intervention is given 30 minutes for 2 weeks continuously given, and it has also excellent improvement, particularly in Pittsburgh Sleep Quality Index. That's very good important indices, and quality sleep quality of life scores actually. That is also and other quality of life score, SF26 WHO scores. These have very good improvement. We can see particularly these Dhara. And Zero Dhara is another study, which is a case series which I have given. With Brahmi Thaila, we have seen Bacopa. It is very important medicine to improve the neurocognitive improvement and other disorders of the memory and cognition. And many studies have been conducted. This Brahmi Tail also used for Sirodhara, and this is also effective, particularly which is indicated insomnia severity index. There is a good reduction, which is significant improvement. These are the another one drug, which is Tagara. This is also one of the and Jatamamsi. These are also very good important botanicals, which is used in Ayurveda for many other disorders, and neurological disorders, psychiatric disorders, and sleep disorders. This both has shown very good improvement, particularly if you have given with 4 to 5 grams. This is here 4 grams given 3 times a day, given for a 1 month, and it has very good efficacy in initiating the sleep and the sleep duration, and this is very and improved the general quality of life also. These are some examples I have shown that and how Ayurveda has a good whole system approach, how we can manage the sleep disorders very efficiently. Some are this is a one drug called parviflora. This is called Tintidika. This is also has an experimental study. This is not a clinical study, and this has shown also it is also improving sleep latency and sleep duration. It has it is a controlled experimental study. It has a very good efficacy. Overall, Ayurveda has very good comprehensive understanding of the sleep, and the classification of sleep, how sleep impairment is related consequences of the sleep impairment, nidranas, how to manage sleep, what is the role of kapha and tamas, and how it is
Thank you
how
so
we
much,
can
sir.
manage it is given. Thank you very much, madam. Thank you for giving me opportunity.
Thank you so much, sir. Thanks for your great statistical data and all the research work you had been doing. We are now asking for questions, but before other questions are coming, I would like to ask you a question from my side. What would be your guideline for collaborative projects to recognize and treat sleep disorders in current times, and how we can implement it? And do you have any project suggested for Africa Study Center? Maybe we can implement it in African countries.
Thank you. Thank you very much for your question. Actually, there are several studies, particularly in we can conduct in a collaborative mode. Actually, CCRS has a research policy, and Ministry of Ayush, we have international collaboration schemes also there. And particularly this sleep and sleep disorders have we can study forming a good collaborative study. Very less studies are conducted actually, and we can do a good collaborative study if somebody comes and applies through international collaborative scheme, and CCRS has also collaborated. We can collaborate. You approach through Minister of Ayush, and we can formulate a good proposal and do it.
Thank you so much, sir. Is there any cleansing guidance for predominantly non-vegetarian people that can help them for better sleep management?
Diet actually plays an important role, madam. That's why early taking dinner, that is very important. Second one is also the vata vitiating food. Actually, we have that is ruksha ahara, and all we have to reduce, and that is very important. And we know that this year actually the Minister of Ayush and is promoting Ayurveda, particularly Ayurveda for nutrition, and that's why that we have to have a good balanced diet, and that is as per Ayurveda Shadrasas, and taking time. These are Ashtavidahar with Vishesha Ayatanas we have to follow, and that's why we have Ekarasabhyasam. Only one type of food we should not take for long time, and either increasing kapha. Actually, kapha nidra nasa avuthundi. Excessive sleep is also a problem, and they're different. That's why we have to have this balanced approach, man. That's right.
Thank you, sir. If there are any other questions, we will look for them and we will direct that to you. Thank you so much for your time.
Thank you, madam. Thank you.
Thank you, sir.